you've got your right auricle and your left auricle. Inside of that, you have your, you have your right atrium. Blood is going to pass from the right atrium into the right ventricle, and it's going to go through the tricuspid valve, which is the white thing. And the tricuspid valve is attached to the heart by what this red structure is right here, number 62 or something. Those are your chordae, those are your, actually the white strings are your chordae tendineae. Where this red is, that's actually where it attaches to the heart, so that's going to be your papillary muscle. So if you look at where this attaches, the red is where it attaches to the heart. That's papillary muscle on the heart side. These strings are the chordae tendineae. This is the valve itself. Okay, so you're in the right ventricle. From here, if you go up inside, this other white valve right here, this is going to be the pulmonary valve. It's going to go up into the pulmonary trunk, and then it's going to go to the left pulmonary artery and the right pulmonary artery. You're going to go to the lungs, come back in by way of the left pulmonary veins and the right pulmonary veins. They're going to empty into the left atrium, and you can see up in here where they're emptying in. The left atrium, it's then going to pass through the mitral valve or the bicuspid valve. You've got your chordae tendineae. Where they attach is the papillary muscle, and you can see all the ridges in this ventricle, and that represents the trabeculae carneae. As the blood leaves, if you look back up in here, way up in there, you can see another white valve. That is your aortic valve. As it leaves the as it goes through the aortic valve, it's going to go up into the ascending portion of the aorta, the aortic arch, and then down the descending limb of the aorta. This is your septum. Outside is your pericardium. This inside right here is your myocardium, and then the innermost layer is your endocardium. This structure right here is something that adults have. It is the ligamentum arteriosum. It's where the pulmonary trunk and the aorta were once fused. And then if you look inside of your right atrium, you can see this structure right here. This is the fossa ovalis. This is where the right atrium and the left atrium had an opening where blood was able to pass through, but in the adult it's just a depression. If you look inside here, you can see where there's a red dot. That represents where the inferior vena cava blood is entering. If you look up here, this is where the superior vena cava blood is entering. So this structure right here represents your superior vena cava. This structure down here represents your inferior vena cava. In addition, you also have another red dot, which represents where your coronary sinus is entering. So if you flip it over on the back, where on earth did that go? There we go. There's that bulgy vein right there. All the blood is pooling into that one area, and then this coronary sinus is then emptying its contents into the right atrium as well. So that's all the places that blood, where the right atrium gets its blood from.